the hell that was. That was Courtney Asuma. What in the hell is a Courtney Asuma? Can I assume that song sucked? Yes. 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 I will assume. I will assume that song was horrible. Go ahead and get a hold of us on Facebook, facebook.com/the Jiggy Jaguar. Or Sunday radio broadcast is up and running each and every week. Find us on iHeartRadio. Also Facebook as well. We are going to go to our next guest here in just a few moments. And Dr. Roth is going to join us here in a few moments. Not to be confused with Diamond David Lee Roth. I don't think Diamond David Lee Roth is anywhere near... I think Dr. Roth is joining us on the phone. How are you, Doctor?
Doing well. How are you?
Pretty good, actually. We're going to be... let me connect my co-host here, Jay Bird Wells, with us. And as we do that, let's tell you about our broadcast here. You can get a hold of us on the iHeartRadio app. Do so. That is your best bet to download our broadcast each and every week. Also, follow us on Radio Xenu as well. And I believe Jay Bird Wells has joined us on the Skype-a-rooney here. And Dr. Roth, I had a few listeners when we mentioned that we were going to have you on the show. And this is why we don't allow calls on this show. I had a few folks ask me if you're related to David Lee Roth, and I figured I had to just get that out there so we could shut these people up. I'm assuming you're not related to David Lee Roth.
Very fair. I am not.
Okay.
Sorry to disappoint. I'm already disappointing. That's great.
Well,
sorry,
at least you're a good sport about these things, Doctor. I think it's amazing, and. At least, you know, and part of the reason why we don't allow calls on this show is because we have you on, you're highly educated, you're an expert in your field, and all these idiots that listen to this show, all they can come up with is the doctor related to Diamond David Lee Roth? So that is just the aspect that is our listening and viewing audience for you.
Got it.
And we love them, but sometimes it's just
speak for yourself.
Just listen to the show. Just listen to the show. That's all we ask. And we've got a great guest with us today. As I mentioned, Dr. Roth joins us, and the fireworks situation just took place when we taped this broadcast. 4th of July was about a week or two ago, and I wanted to have you on to discuss a recent survey and recent preparation as far as getting the pets ready for different things. And I know that for whatever reason, 4th of July is not just a time when we do fireworks. Apparently, they do fireworks. It's sometimes in some states, it seems like that they're doing them every day, every day, all year. But we wanted to have you on as
party.
It seems to be as a pet expert. Kind of give us some tips here on how we can keep our pets safe, and kind of what we can do with everything, Dr. Roth.
Yeah, definitely. So I'm the director of a company called Ask.vet. And what we do is exactly that. We try and prepare people for things that are going to affect their pet's health and their well-being in general. And so the first things, if you know that fireworks are going to happen, is to prepare for your pet to try and run. It basically sounds like World War III to them. It's really, really loud, and it's unexpected. They don't know that their people are about to have fun, and so all they hear is sudden explosions, which would scare anyone.
Yes.
And their hearing is so much better than ours and so much more acute, but they're actually even hearing parts of the explosions that we cannot.
Ugh.
And so one of the things that you can do is, walk around your yard, check for areas that the pet may be able to escape from. And so what's notorious is the corner of the gate. They always get out of there. And if they've had any opportunities to dig underneath the gate, they're going to remember where those holes are when they're terrified, and they're going to try to run. Now, if you weren't able to do that part of it and they did run away, then hopefully they're microchipped. And if not, that is one of the things that I highly, highly recommend you take the effort to get done. Most humane societies, every single vet clinic will be able to microchip. And the purpose of that is not a GPS tracking for your pet, but if somebody picks it up, they take it. We all scan lost pets. That's we get them back to you if they do happen to escape.
Yes.
The next thing, if you know that your pet is going to be one of those ones that loses it, don't be afraid to ask for medication from your veterinarian. We have special anti-anxiety medications that are different from just regular sedation. These actually help the pets with their anxiety, with the fear aspect of it. And so, if they're not necessarily up for, either they've procrastinated and are not able to get into the vet office in time, one of the other options of that is called the Thunder Shirt. It's completely drug-free. It is a vest that you actually put onto your pet, and you Velcro it really snugly to them. And what it does is it makes them being held. So just like when your buddy gives you a hug, it releases endorphins. Those are the chemicals that make you go, ah, and help you relax. The same thing happens in the pets when you strap on that Thunder Shirt. And so it does actually help them to relax without necessarily having extra chemicals in their body.
Yeah.
Now, there's some that just have to have it. That if you know that your pet, there are some that even bite themselves, run into walls, bite other people if they're so anxious. And if that's your pet, go ahead and ask for anti-anxiety medications. There's no reason to try and make them ride it out because they don't understand. Some of the other things that are really important that don't necessarily even apply to the 4th of July either is that anytime we have cookouts, barbecues, guests over, make sure that your trash is up and out of the way. I can't tell you how many corn cobs I have cut out of pets because they don't digest and they get trapped in the GI tract. Yes. And you're talking, maybe 50-cent ear of corn, suddenly $2,000 to $3,000. And so it's best to avoid having it given to your pet at all, keeping the trash locked or at least in a separate room with the door shut so that the pets aren't able to get to it. The same thing goes for rib bones. Back in the day, we used to give our dogs bones all the time, and I never understood why they would get sick and then we wouldn't see them anymore. In all actuality, but when we, as a practice, as a veterinary practice, when we know better, we try and do better for our pets. And that's what Ask.Vet is all about. And so educating people that cooked bones are really not that great for your pet. They actually splinter and can poke holes in the GI tract from the inside out. So there's poop in there, and and then what it does is it causes that bacteria from the GI tract to be able to leak into the blood. And so it's not even necessarily sometimes that I can even fix those guys. And so it's pretty serious. And we just want to make sure that people are aware that it's something that a lot of people don't know could be harmful for their pet.
How can you tell if you've got a dog that got into the corn cob without permission?
Vomiting, lots of it. Usually they'll feel pretty cruddy as well, unless it's a lab, because nothing ever makes a lab feel cruddy. So they may still be running around and trying to vomit routinely, and anytime they eat or drink, it'll come right back up. And that is a huge red flag that something very serious is going on. Even if it's not something that's stuck in the GI tract, if your pet is getting human food, their pancreas can actually get inflamed, and that's called pancreatitis. And so that can also cause a lot of vomiting and for their bellies to be painful. And so it's one of those things that we usually end up having to do x-rays because I can't ask my pet, my patients, where does it hurt? And so that's often where we end up, and we can either diagnose pancreatitis or we diagnose if something is in fact stuck in the GI tract.
Interesting aspect of things. We've got a great guest with us today. Dr. Roth joins us. And how did you guys develop the website over there? Because it's got a lot of great information on it.
It does, and it's actually what we kind of hang our hat on is actually talking one-on-one with the clients. It's a lot different than when clients call in to a vet clinic. A lot of people don't realize this, but they're talking to a receptionist or a vet tech. But with Ask.Vet, you're actually just texting from your phone, and you're talking to a doctor. and it's within a couple of minutes usually. And so it's one of those things that we really want to make sure that veterinary medicine is more accessible. We're all in a hurry. We're all really busy. And that way you can ask the questions that you need to about your pet. It doesn't necessarily have to be the, hey, my dog is vomiting. It can be, my puppy's 12 weeks old. I don't know what vaccines to get. All types of questions that we are able to field directly to the client about their specific pet without them having to step foot in the vet office unless it's recommended. And so it's one of those things that it's a time saver. It's a lifesaver. There are some times where people have texted in not realizing that it's an emergency, and we're able to let them know, no, this is really serious. You need to go ahead and get your pet in to an emergency room. And it's really nice when we are able to get that feedback from the owners later on. Hey, you know, you guys really helped save our pet. And so it really is as simple as texting in. They text the word vet, V-E-T, to 67076, and customer care puts them in contact with a veterinarian right away.
Amazing stuff. We've got a great guest with us today. Dr. Roth joins us here on our broadcast, and you have a wealth of information over there on the website. How often do you guys update the website and put some of the different things out there?
We do update it pretty routinely, but what we really aim for is just getting that one-on-one discussion with the owner. You know, that way, you know, they're not necessarily reading cookie-cutter information off the internet, but we can tailor our advice and our recommendations to their individual pet, because not every single pet is the same, you know, and we want to make sure that the goal of Ask.vet is to make sure that we're chatting with people about their unique situation. It's so easy to get bogged down in things from Googling and what's real, what's not, what's somebody else's opinion, what's not. And so putting them in contact with a veterinarian about their unique situation is really what the service is all about.
It is a great guest with us today. She joins us live. Dr. Roth is with us, and there is a lot of tips on your website for all sorts of pet related issues. Do you guys often take suggestions or anything from email, or how does that work exactly?
Absolutely, and actually they can text in with suggestions. The other email address is veterinarians@ask.vet. It's on the website. The website is ask.vet. And so that's the way that you can get in contact with us. You know, one of the other things I want to make sure that I mention just in general for the summer is making sure that people are aware of heat and heat-related injuries in pets, because we do see a lot of heat stroke this time of year, a lot of really severe paw pad burns as well, because, you know, we still want to get out with our pets, we still want to walk around, and some people just forget that we're walking around in shoes while pets are not. And so one of the things that I always recommend to my clients is placing their hand on the concrete, and if it's too hot for them to stand it, it's far too hot for their pets to be on it as well. So seek a grassed area, or, you know, walk them first thing in the morning or later in the evening when it started to cool off.
Good stuff. You've got a lot of good tips here. Now, what got you interested in the world of pets, Doctor?
You know, I actually had the choice of going to human medical school or veterinary medical school, and I chose veterinary medicine for a few reasons. Number one, which is kind of odd and it's a bit weird, not necessarily, it's about people, but it's also about giving pets a voice and advocating for those pets. So being able to do medicine on animals is a lot like being a pediatrician, right? In that your patients can't talk to you, and you just have to be a really good detective. And sometimes, you know, we're able to help them. And if it's a time that is for, you know, euthanasia or putting your pets to sleep, those are actually the times that I feel like the veterinarians are able to shine the most, because we're able to advocate for that pet and let their owners know when the suffering is enough.
We've got a great guest with us today. She joins us live here on our big broadcast, coast to coast and border to border on TuneIn, iTunes, and Radio Loyalty. Dr. Roth with us today here on our big program. And Doctor, I guess to kind of wrap things up here with you, my friend, one thing that I want to get your thoughts on, which I see this a lot on social media, and it kind of aggravates me as someone who loves animals and is a big fan of pets and things. What is the big deal with all this stuff where we're seeing all these social media trends of these people smoking drugs or doing different things with their pets and having, drug paraphernalia involved, or they're blowing marijuana smoke in their faces and crap like that? What is going on with all this? Why is that a big social media trend?
It's one of those things that I think that people want to prey on things that are helpless, and that's one of the things that veterinary medicine is about, is advocating for those pets if they don't have a voice. Certainly those people think that it's funny, but it's not. I've certainly lost patients from overdoses of human recreational drugs, and it's really heartbreaking because the pet had nothing to do with it and, was an innocent bystander trusting their person. And so it is one of those things that even if it's accidental, make sure that you're really upfront with your veterinarian for what has happened with the pet, because that is the best way that we can try and save the pet's life if we know what's going on. Sometimes I've been a vet long enough and I've worked enough emergency that I can pretty much get on physical exam and blood work what the pet got into, if you know what I mean. And so it saves us time, and it saves us the energy that we would be putting towards saving that pet if we don't have to do that detective work. But, as far as people doing that, it's animal abuse. And if you do know people that are doing that to their pets, it is something that is reportable to the Animal Humane Society. It's not okay. And certainly, there are definitely situations where it's hard to be a veterinarian sometimes because of the types of things that we have to see people doing to pets. And so, our job, we just try really hard to make sure that we're advocating for them, that if a client doesn't know what to do about their pet's situation, that we'll make sure that we're accessible to them. And so that hopefully will decrease the incidences of getting into toxic things, because access to a doctor right away to know to ask those questions. And it's judgment free. I would much rather people ask, hey doc, is it okay if my pet has XYZ? Versus would rather than text in and ask than anything else. And one of the bigger toxicities that we see in veterinary medicine is people giving over-the-counter pain medications to their pets. Ibuprofen, Tylenol is actually toxic to a lot of my patients. And so there are no safe over-the-counter pain medications for dogs and cats. Period, the end. If you feel like your pet is in pain, they need to talk to a doctor. You need to see a doctor. And so, definitely, it's always really heartbreaking, and we have to go through life-saving efforts because the dog has gotten ibuprofen when it's something that, obviously the owner was trying to help, but it ended up being toxic and really hurt their liver. And so, again, it's about that accessibility to a doctor within minutes that we were really pushing for to make sure that we're educated the best parents they can.
Well, before we let you go, Jay, do you have any more questions for the doctor, or has she answered pretty much everything that you had today?
What about this whole controversy about how they're giving immunization shots to like a 5-pound cat and the same as a 100-pound dog?
Well, that's a really great question, and it's a super sensitive topic for some owners. But when it really comes down to it, it all relates to how the immune system works. So let's say you're out camping. You want to start a fire. Do you change the size of the spark if you want a big fire or a little fire? No, right? It's all the same kind of spark. So the way that I explain vaccines to owners is that it's a spark. What we're starting is an immune system response. And so that spark, whether you're making a bonfire or a little something to make a hot dog, that spark is exactly the same. And so that's the reason why the dosing actually does not matter as far as the size of the pet is concerned. It's the spark that we're looking for to start that immune system response. Does that make sense?
Yeah. I'll agree to disagree there.
That's all right, but so that's the goal of it, is that if you're making a big fire, you don't necessarily have to use a whole gallon of gasoline, right? You're using a match, just the same. If you're going to do a small fire, you're going to use a match, and so the immune system is very much so very powerful, and so the way that it started is by a spark, and the vaccine is actually the spark that starts it.
Wow. That's a we're getting some education here today from Dr. Roth. And Doctor, if people want to find you online or social media, how do they do that? How do they get a hold of you exactly?
Yeah, so it's ask.vet, and I answer questions via text as well. And so, they can text in the word vet to 67076. I am on the ask.vet Facebook page as well. We do webinars to go over important topics. The last one that we did was ways to make sure that you're traveling safe with your pet. Going over things like health certificates, making sure your pet's on flea and tick prevent if you're going to an area that has Lyme disease or plague, which is really high where I live. And so those types of things, try and make sure that our clients and the people that are interested are getting educated on behalf of their pets to make sure that they're doing the best that they possibly can.
Now, if people want to get a hold of you on social media, do you have a Facebook page or Twitter page or anything like that?
Not me individually, but they do. I monitor the ask.vet Facebook page, and so if they did have a message for me, that would be the way to get a hold of me, is through ask.vet, either on the web page itself or on the Facebook page. And so you send a message to Dr. Roth on the ask.vet Facebook page, it gets to me.
Fantastic. Well, Dr. Roth, I appreciate you being with us today. Jay, I will call you back here in just a second, my friend.
Okay.
Thank you much, Doctor. We really enjoyed the conversation.
Doctor.
Yeah, if you need something else, give me a call, okay?
Appreciate it. Thank you very much. Jay Bird Wells and our doctor with us today, ask.vet, I think. Go back, listen. I'm too lazy. Check out JiggyJaguar.com for more information on the good doctor. We're going to have that interview up on our website here in just a few seconds. Here on iHeartRadio app is available. JiggyJaguar.com, JiggyJaguar.us if you want to